I may have an answer for some of you with hypertension. It's not going to be for everyone. I have found out that if you have a high homocysteine level, and that's caused by 7 different genetic homozygosities, so 7 different matched pairs of your genes, it can cause you to have a high homocysteine level. Homocysteine is interesting. It doesn't affect you directly, but it causes the release from white blood cells, or actually monocytes, from monocytes of 2 substances called cytokines. One is called interleukin-8, IL-8, and the other is MCP-1, monocyte chemoprotectant 1. You can get your IL-8 level checked readily by your physician. It's available at almost any lab. MCP-1 is a little different beast, hard to get it checked. But IL-8 and MCP-1 cause stiffening of your arteries, which automatically increases your blood pressure. You can go years with normal blood pressure, but if you have a high homocysteine, one day it can just flip. Your interleukin-8 and your MCP-1 cause your blood pressure to go up because your arteries suddenly get really stiff. They just had enough and they just get stiff. It can also cause heart attacks and strokes and a lot of other bad problems. It is the #1 cause of kidney failure, especially when your arteries are stiff and the high blood pressure. I saw a patient with a 280 over 180. All of a sudden, he'd always had normal blood pressure, and he was in kidney failure. He needed to go on dialysis. The way we bring that blood pressure down is give you glutathione. Why does that work? Homocysteine is a cardiovascular waste product, but it builds up due to a dysfunction in your transsulfuration pathway, meaning one of those 7 genes I discussed earlier. It could be MTR, MTRR, CBS, MTHFR C677T, MTHFR A1298C, FOLH1, GGH. If you're homozygous on any of those 7, you're going to have a high homocysteine level. There's no way around it. You can't bring down the homocysteine, you can bring down your IL-8. The way you bring down your IL-8 is, remember, homocysteine and glutathione are 2 sides of the same transsulfuration pathway coin. It's all about converting glutathione to homocysteine, homocysteine back to glutathione. That's a transsulfuration pathway. It's also how you detox. And so you take enough glutathione and it lowers that IL-8. If it's not gone on too long, the IL-8 being lowered causes your arteries to allow it to become soft again, and your blood pressure drops dramatically to normal. So I've seen it now several times. It's not, I wouldn't say it's a huge number of patients we've had to do it yet, but I'm going to see more of it as time goes by. We realized glutathione, we have the only patented oral glutathione in the world, by the way. So this is Dr. Dan Purser. There's a hope for some of your high blood pressure, especially the crazy ones that the doctors can't seem to get their finger on. They're giving you 3 or 4 medications, and it might be a homocysteine problem. Get your homocysteine level checked. If it's high, try some of our glutathione. It usually takes 3 or 4 or 5 a day to bring it down. But that's what I've seen. Thanks.